The following program is sponsored by the Medicine Center Pharmacies.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist and host, Paul White. We're very glad you joined us this morning. Before we begin, I'd like to thank our sponsors, Mercy Medical Center, Studio Arts and Glass, Kempthorne Motors, Kiko Auctioneers, and, of course, our technical producer, J.D. DeAngelis. This morning in the studio with me is Brad White, a compounding pharmacist. And we were to have a special guest this morning, and she's very ill. So Brad and I are going to talk to you this morning about many contributing and things that we do at our pharmacies and pharmacy issues. So we hope you'll find it informing. So it is Good Friday. And again, we're going to be talking about what's happening, the latest things happening in pharmacy.
All right, good morning. Couple things we wanted to talk about today is some of the common things that we get asked when you walk in the pharmacy. And, it's not uncommon for people to spend more time talking to their pharmacist than it is their physician. Physicians are very busy and they have excellent knowledge, but sometimes if you're in between doctor visits, it's real easy for you to pop into the medicine center and we can help you with your healthcare needs. And one of the things that has been the most popular service that we have offering of late is what we call we call it internally, we call it medication synchronization, but you, our patients, may know it more as having a health coach. And what we do is we assign a pharmacy technician to you, the patient, and every month they're going to give you a phone call about a week before your medications come due. And they're going to go over your medications with you and find out if there's any changes, if you're having any troubles getting refills from your doctor. Maybe you need a vitamin supplement that you heard about or read about in the newspaper and you want more information on that. So the health coach is designed to be your ambassador to the Medicine Center Pharmacy to help you make sure that your medications are taken care of in an efficient manner. And together they're going to work with you to help make sure you can either pick them up or get them delivered on a specific day of the month to try to minimize your trips into the pharmacy and make more use of your time because you're busy too, just like we are at the pharmacy. So we're striving to serve you better and more efficiently in a more organized fashion, and our health coaches are an extension of the medicine center that can call you in your home and help you organize your healthcare needs. And it's something that's been very popular. We've got a couple different ways that we can do it. Many people are used to your traditional prescription vials. Sometimes, though, when you get more than one medication, it gets a little challenging to manage your medication. And we have a couple different options that you can use to simplify your medication. One of the methods we have are these fancy blister packs. These blister packs can be designed to be taken throughout the day. For example, breakfast, lunch, dinner, maybe even bedtime. And your medications can be packaged individually in them. And each packet is designed for a specific dose time. So if you're a busy person and you have to go to work and you only want to take your maybe breakfast and lunch medication with you, you can tear off two of these guys and you can take them with you to lunch. And you don't have to worry about taking the whole box or taking your whole prescription bottle and leaving it at work or something like that. So we also have a convenient bingo card. It's like a card about the size of a piece of paper, and it's got a list of morning, noon, evening, night on it. And we have multiple ways of helping you keep track of your medication. So it's one thing that can maybe help enhance your medication needs. Oftentimes it's challenging. Sometimes I have trouble remembering to take my vitamins at lunch, so I can appreciate how for a patient it can be very challenging to manage 4 to 6 medications or maybe more depending on your needs. Don't be afraid to ask us at the Medicine Center, how can you help me take my medication more efficiently and make sure I don't miss doses?
And we still bottle prescriptions. The vast majority of our prescriptions are bottled. And these particular devices, like the strip packaging and we call them the bingo cards, really are designed for those folks who take a lot of medicine, and it's very difficult to remember. Okay, did I take that pill? Did I take this pill? Did I, if you take one every other day or one every third day and one daily and all that sort of thing. So it is designed to streamline and make sure that you take your proper medication every time that it's supposed to be taken. Because let's face it, if you don't take your medication regularly, you get no results. So,
and it is important. You may not realize it as a patient. Every once in a while, patients express to us that they want more time to talk about their medications, or sometimes it's challenging for them to understand what they're for. At the Medicine Center, that's what we're there for. It's okay if you don't know how exactly to pronounce your medication. We can help you with that. Sometimes those words are long and complicated, but it's really important that you know what you're taking, and especially in the case, God forbid, of an emergency. We could provide you with a nice little pocket handout printout that you can put in your purse or put in your wallet, and you can take with you of all your medications you're taking and how often you take it and which doctor ordered them. And that can be something that's really valuable. Not only can it help you keep track of what you're taking when you go to the doctor, because most patients that come see us now at the pharmacy see more than one doctor. And it can be challenging, even in our electronic world, to communicate from one physician to another effectively what all you're taking. And please make sure when you go to your physician that you tell them not only what you're taking from other doctors, but you also tell them about your over-the-counter medications. Over-the-counter medications, by definition, are things that you might take for a headache, like Tylenol or Motrin. It could be a vitamin, like a multivitamin or a fish oil or a magnesium pill. It could be an herbal product that you think you're taking for the benefit of preventative health care, whether it be cholesterol or to help you sleep. So all those things can be really important. So sometimes one of those medications may interact with another, and that's where we at the Medicine Center, our pharmacists, can help you make sure that you're not taking something that could be a problem for your overall health care. So we want to make sure that there's no drug interactions. One of our popular services we offer now, too, is a medication review, especially patients that have Medicare Part D. Your insurance company will often sponsor a medication review on an annual basis, and we can sit down with you. It takes 15, 20 minutes. We can go over all your medications and what you're taking and your allergies. We can help explain to you what your medications are for, and we can help you find solutions to problems you have that maybe you haven't had time to talk to your doctor about yet. And it's kind of our Medicine Center triage way of helping you deal with healthcare problems that are here and now, even though you might not be able to get into your doctor right away.
And remember, our company, Medicine Center Pharmacies, has 13 pharmacists on staff most of the time in our 4 stores. So we're there to talk to you. It's unlike a chain environment where you walk in there and you have to wait and wait and wait because they only have one pharmacist. But our technicians also are very skilled. Most have been with us for a long time and have kind of grown up in this medication therapy management and syncing your meds and some other things like that. So what about some of the newer things, Brad? Like, I'll tell you what about our vitamin program for kids? Maybe we better jump to that.
All right. Well, if you have a child ages K through 5, we have a program to try to help improve their dietary intake. And while we can't help make breakfast, lunch, or dinner, we can offer what we call our Free Kids Vitamin Program. We basically have a children's chewable vitamin that we can offer you a free bottle every month. And it's a real simple program. You stop in the pharmacy and ask about our Free Kids Vitamin Program, and you can sign up on right at the counter, and one of our happy pharmacy technicians will help you get your free bottle. All you have to do is come in every month and sign up your child. And don't be afraid to tell your friends about it. I mean, it's something that's real simple. It's a chewable vitamin that is something that it tastes good. It's got the basic nutrients from A to Z, and it'll complement a well-balanced diet, but it'll also make sure it gives them some information that is helpful and some nutrients that are helpful that maybe they're missing in their daily diet. You know, all of us can be finicky eaters, whether we're a child or an adult, and, you know, a balanced multivitamin for a child or an adult is a great idea. We happen to have a program that helps kids ages K through 5, and don't discount the fact that a multivitamin has been found to decrease your risk of getting even just the common cold by 20%. So that's something that might be very beneficial.
Well, let's face it, the fast food diet that most of us gravitate in, children as well, they're not getting all the vitamins and minerals that the system really requires. So What about our low-cost diabetes program?
All right. Well, our low-cost diabetes program, I can imagine that any patient with diabetes you're under a lot of pressure. Not only are you under pressure to watch your diet and watch your blood sugars, you're usually taking multiple medications to help manage that. By the way, the stress of that can increase your blood sugar, but that's another story. One of the things that's been a big stressor we found in the pharmacy is the cost of blood glucose monitoring equipment and test strips. For years and years and years, the industry was dominated by a select few of manufacturers, and their prices were extraordinary, if you will. Happily, with technology and knowledge and innovation, we've been able to hook up with a company that we actually get our products out of Cuyahoga Falls from, and they make a meter called the EasyMax meter. And this little kit, if you stop in our Medicine Center pharmacies and you are a diabetes patient and you're newly diagnosed or you're a new patient to us, you can get a free kit just like this one, and it has our EasyMax blood glucose monitor in it. You will get that for free. You'll get a box of 50 test strips, which are also free in here, and a lancing device and some glucose tablets. And for a little bit of fun, because it is Easter and everybody needs to have a little bit of fun, is the Russell Stover sugar-free candy pack. So our goal with this package is a couple things. One, most of the time your insurance company will pay for your diabetes test strips, and that's great, but some of the challenges are the paperwork. And Medicare in particular has very strict guidelines on what is required for us to bill your blood glucose monitor to the pharmacy or to the insurance company. And sometimes getting that paperwork takes a couple extra steps. So our goal when you walk into the pharmacy is, one, you can get a free blood glucose monitor and test strips to start checking your blood sugar today, so that you know today where your blood sugar levels are at, so you and your doctor and us at the Medicine Center can help you work toward a better health outlook for your diabetes diagnosis. The other bonus is that regardless of your insurance coverage, this meter is affordable because we can give you the first meter for free. The test strips cost basically $7.99 a box. So it's something that for 50. So even if your insurance company has a limit on how many you can get in a month or 3-month period of time, it's very affordable for you to monitor your blood sugar. Your blood sugar, your doctor wants you to be in certain levels, not to give you a hard time, but they want your blood sugar in certain levels for a number of reasons. Some of those reasons are to make sure it protects your kidneys and your heart and your eyes and your nerves, but also because, in theory, when your blood sugar is balanced between a certain number, you'll feel better, you'll have more energy, you'll sleep better, and you'll be less prone to get infections and colds and things of that nature. And it'll help improve your quality of life over the long term. So one of the basic ways you can do this is to test your blood sugar regularly. Talk with your doctor about how often. Generally, we see patients that are taking insulin or injectable products test more frequently per day than a patient that's taking oral medications. But it's still our priority that if you're taking oral medications, it's still good to test once a day to kind of give yourself a benchmark. Different analogies are, an apple a day keeps the doctor away, right? Well, testing your blood sugar daily helps give you an idea of where your blood sugar's at. It also helps you understand what happens when maybe you have that piece of Easter candy over the weekend, and you'll know how it affects your blood sugar, and you can adjust.
One piece. Okay. You're listening to pharmacists Paul White and Brad White, and we're talking about pharmacy today.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshoprx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Hi, this is Brad White, your Medicine Center pharmacist. Are you paying big bucks for a little blue Viagra pill? There's a better alternative. Starting at only $4 per dose with a prescription from your doctor, the Medicine Center Pharmacy can prepare a sildenafil or tadalafil tablet that melts in your mouth for an affordable price. This allows you to take care of business and still have money left over for dinner and a movie. The Medicine Center Pharmacy has 4 locations in Stark and Tuscarawas counties. We're here to keep you healthy and save you money. Give us a call at 330-339-4466 for more information.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Hi, Paul White for the Medicine Center Pharmacies. If you had chickenpox, you are at risk for shingles. Shingrix, the new vaccine for shingles, is now in our pharmacies. Did you already get the other shot? Shingrix is more effective, and you will need to get a 2-shot regimen. Talk to your Medicine Center pharmacist and learn more about this new injection. The Medicine Center Pharmacies at Canton, Louisville, Minerva, and New Philadelphia, where wellness begins. See us on MedShopRx.com. We keep hearing on the radio that the big chain pharmacies have all kinds of zero copays on Medicare Part D programs, as do we. But our pharmacists using iMedicare software have saved Part D patients lots of dollars by helping select the right Medicare Part D plan during open enrollment. Not all Part D programs cover the same drugs. Our pharmacists make sure that the Medicare Part D enrollees see all the available programs that are the best for them. The Medicine Center Pharmacies in Canton, Louisville, Minerva, and New Philadelphia, 13 pharmacists to serve you. See us on MedShopRx.com. Welcome back to Health Matters with the Medicine Center Pharmacy. Today you're listening to Brad White and Paul White, pharmacists, talking about our pharmacies.
All right, well, the big news, we've made it almost officially through flu season. And, if you were affected by the flu, whether you got the flu shot or not last year, for this particular season, all of the healthcare professionals encourage you to think about it. Getting vaccination does help reduce the risk of you getting any condition. Is the shot always 100% effective? No. But it does help give your immune system a boost and help you get prepared for what is out there. As a matter of fact, we are already working with local businesses and other organizations to schedule for flu clinics for next year. So if your business was particularly hard hit with the flu and sickness and lost productivity and illness this year, don't be afraid to give us a call at the Medicine Center Pharmacy, and we can work with you to schedule a flu clinic at your business. And we can help try to keep us all a little healthier for the next season. But speaking of vaccines, one of the vaccines that we have gotten the most questions about of late is Shingrix. Shingrix is a brand new vaccine for shingles. It has recently been approved just late last November. And there's been a lot of questions in the pharmacy for us about this vaccine. One of the really interesting things is it's nice to have more than one option for the shingles disorder. If you've ever had shingles, if you've ever seen anyone with shingles or had a loved one with shingles, it can be a very uncomfortable and a very difficult condition to work through. It can be painful. The results can be long-term. Nerve damage, which that discomfort can stick with you long-term. So it's something that your physician, your pharmacist at the Medicine Center will recommend you get vaccinated for. The great thing about Shingrix is this new vaccine has a higher potential to be more effective for you. It's patients ages 50 or older are eligible. Generally, your insurance company will cover the prescription. We can talk about that and make sure that that coverage is available for you. Unlike another vaccine that you may have heard of for shingles, this one is a 2-dose vaccine. So generally you get a dose today, and then you get your second dose in 2 to 6 months. So that it's a two vaccines in the series, much like other vaccines for hepatitis or things of that nature. But the CDC, which is the Centers for Disease Control, they're kind of our healthcare watchdog here in the country. They recommend that you get Shingrix whether or not you've had Zostavax, which is the other vaccine. And, you can go to the doctor and talk to your doctor about it. You can come into the Medicine Center Pharmacy and we can talk about it. Our pharmacist can give it to you there on site, so you don't technically need to schedule an appointment. You can walk in at your convenience and we can work with you to deal with insurance coverage and the administration of that vaccine. So if you don't know about shingles, I also encourage you to talk to our pharmacist about it. It's definitely something that, given that there's a vaccine out there, much like chickenpox for kids, there's no reason to suffer with that malady. Get vaccinated and avoid that problem altogether.
Now, we're doing other vaccines also, correct?
We are. The move in healthcare lately has been for pharmacies and pharmacists to complement your primary care physician much more, and one of those ways has been vaccines. In the past, 10 years or so, it started with flu and pneumonia vaccines in the pharmacy, so you can get your pneumococcal vaccines with us at the medicine centers, whether it be Prevnar 13 or Pneumovax 23. We can also help you with other vaccines. Sometimes patients need a hepatitis B series for their employment. Probably next to shingles vaccines, the most common vaccine we've been doing lately are the tetanus and diphtheria booster vaccines. Sometimes they're abbreviated Tdap or TDAP. The most common patient we've had come in for those lately are patients that are grandparents or parents who've recently had a baby. And physicians are recommending that all caregivers for newborns get a Tdap booster to prevent transmission of any of those communicable diseases, because unfortunately it has been on the rise. So that's something you can get at the medicine centers too, a Tdap booster, and that way you can keep your newborn baby or grandbaby happy and healthy.
Okay, bottom of the hour, time for the news. You'll listen to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
We understand the one-size-fits-all approach doesn't always work. We do customized compounded medications based on your doctor's prescription to match your specific needs. Hi, I'm your pharmacist Brad White from the Medicine Center Pharmacy. Do you use or need customized compounded prescription medications because of allergies, special formulations, or need an easier way to take your medication that isn't available? Many physicians choose to prescribe a medication that is not commercially made and requires a pharmacy like ours with special equipment and training to prepare a capsule, suspension, cream, or tablet. Are you sensitive to lactose, dyes, or need a sugar-free suspension? The Medicine Center Pharmacy is here to help you. Every day we prepare custom medications for infants, adults, and pets in our PCAB accredited compounding lab. Call or stop by the Medicine Center Pharmacy today at 551 West High Avenue in New Philadelphia, where wellness begins.
Spring is in the air, and it's the perfect time to shop Northeast Ohio's largest auto mall with one click at KimThorne.com. Mazda, Volkswagen, Volvo, Jaguar, Mercedes-Benz. Something for everyone's price range. And KimThorne.com makes shopping easy, fun, and friendly. Less than stellar credit? It's never a problem. We have a huge selection of pre-owned vehicles to choose from. The Kim Thorne family name's one you know and trust that's been committed to our community for over 80 years. Shop KimThorne.com.
Hi, this is Brad White, your Medicine Center pharmacist. Are you paying big bucks for a little blue Viagra pill? There's a better alternative. Starting at only $4 per dose with a prescription from your doctor, the Medicine Center Pharmacy can prepare a sildenafil or tadalafil tablet that melts in your mouth for an affordable price. This allows you to take care of business and still have money left over for dinner and a movie. The Medicine Center Pharmacy has 4 locations in Stark and Tuscarawas counties. We're here to keep you healthy and save you money. Give us a call at 330-339-4466 for more information.
Brighten your day with beautiful stained glass from Studio Arts and Glass. Let the sun shine in through a stunning beveled glass window that forms a rainbow on your walls. Commission a piece of art to cherish for years. All at Studio Arts and Glass on Apple Grove and 77 in North Canton. Open Monday through Saturday, 10 to 6, or shop online at studioartsandglass.com. That's studioartsandglass.com.
Welcome back to Health Matters with the Medicine Center Pharmacy. Today you're listening to Brad White and Paul White, both pharmacists, and we are just talking about pharmacy today.
All right, pharmacy stuff. Well, you know, one of the most popular things that we do at the pharmacy, too, is help you figure out how to get your prescriptions. And it could be you walk in and pick them up on a designated time. It could be we deliver to your home. So, you know, if you are unable to get transportation to the pharmacy, you know, we have patients that use our services from all over town, and we might not be their closest pharmacy to them, but they enjoy the convenience of us being able to deliver to them. So don't discount the fact that we might be able to help you with your medication needs if you like what you're hearing today on our program, because we may be able to organize a home delivery, and we deliver all over the area. So it's something that we can help you with to help improve your health care, because if you don't have your medication, it increases your risks of being hospitalized or having high blood pressure or having some healthcare-related event, which we don't want you to have, and neither does your doctor. So one of the biggest challenges for us lately is helping to make sure you have your medication when you need it. So call us, and we can help work that out and schedule it so it's convenient for everyone.
How about we chat about Mercy Medical Center coming into our stores and for monthly blood screenings at a very low cost. They come to our stores on Tuesdays, and they rotate to all 4 of our stores. One Tuesday they're in Canton, one Tuesday they're in Louisville, one in Minerva, and then one in New Philadelphia. And these screenings that they're doing are very low cost, and they're the same screenings that you would get from a physician order, lab, whatever. A1C is $10, and that's offered quarterly. But all these other tests, glucose $2, thyroid $5, total cholesterol $2, liquid profile $8. These are all offered every Tuesday at the particular store that they're at. So we find this to be a great service provided by Mercy Medical Center. A lot of people cannot afford some of the tests that they're getting elsewhere, same tests. And so we urge you to use this service that we provide. I believe the time on this is 9 to 1. Would that be correct, Brad?
Yeah, 9 to 1 in Canton and 9:30 to 1 in Louisville, Minerva, and New Philly.
Correct. So don't be afraid to take advantage of this. It's quick. And as I said earlier, very low cost. So stop in, check it out.
Something else we're involved in is next week, April 7th on Saturday, is the Run Canton Funny Bunny Run. It is going to be out in Massillon at Sippo Lake, and it's a 4-mile run or walk of mixed surfaces around Sippo Lake. So next week, I guarantee good weather. You can come out and enjoy the Sippo Lake environment, and The great thing about it is if you sign up, you can go to their website. It is runcanton.com/funnybunny. Again, it is Saturday, April 7th at 9 a.m. It starts and finishes at Perry Christian Church, and you can get pancakes to follow, so you can work off the pancakes before you eat them.
Ooh, do we get chocolate in the pancakes and all kinds of good stuff? Or?
I don't know about that, but you do get a T-shirt, and the Medicine Center is one of the sponsors, so our name will be on there. You get a finisher medal, there's free parking, and there's fun music and atmosphere. And one thing that I'm very fond of as a Perry resident, the proceeds go to help benefit Perry Helping Perry, and it is a very great organization that is 100% nonprofit. Everything donated to them goes to people and families in need with basic necessities in Perry Township. They have a food pantry, and they accept other donations. So, don't be afraid to consider bringing a non-perishable food item or household item to help Perry Helping Perry.
How about we take a look at the vitamins and vitamin supplements?
I'm so glad you asked. One of my favorite things to talk about is my Brad White recommendations for nutrition and vitamins. And we touched on our kids' vitamin program earlier, and I encourage you, if you have children in ages in grades K through 5, to come into the pharmacy and ask about our free vitamin program. But I fully believe that taking vitamins can help supplement your regular diet on a daily basis. Some things that I'm most fond of are, 1, vitamin D supplementation. Look at it today. It's spring, but it's snowing outside. We live in Ohio. We don't get the sun exposure we need for our skin to make appropriate levels of vitamin D. And vitamin D shows up in more and more research to help not only boost your immune system, but also help early childhood development and other situations. Many people with conditions, chronic diseases, diabetes, heart disease, Alzheimer's. I can't tell you that vitamin D prevents those, but what I can tell you is all those patients with those disease states do have patients generally with a vitamin D deficiency. So ask us at the Medicine Center about vitamin D. Another big one is fish oil. If you have a heart, you can benefit from fish oil. Fish oil has a number of benefits, from hair, skin, and nail integrity and regeneration, because it has essential omega-3 fatty acids in it, which are all building blocks of our hair, skin, and nails. It also can help support healthy cholesterol levels, and it's something also that is really good for heart and blood pressure. So vitamin D, fish oil, magnesium. Magnesium is important for over 300 chemical reactions in your body. It is essential for proper metabolism of everything from hormones to energy to making new skin, or new skin cells, new blood cells. So magnesium is essential. If you ever have leg cramps when you lay down at night, don't reach for that prescription medication. Well, if your doctor prescribed it, do it. But ask your pharmacist about magnesium for leg cramps. And also, I encourage you, if you're not sleeping well, to ask us about magnesium, because a simple magnesium dose about an hour before you go to bed can help improve sleep quality. So it doesn't take a prescription medication to help you sleep better. And also probiotics. Probiotics are something that everyone can benefit from. Probiotics are good bacteria that can help improve your GI tract and your digestive quality. It also helps boost your immune system. 80% of your body's immune function comes through the gut. So think about everything you do. How many times you touch your mouth every day, and things you eat. If you ingest something that has a bacteria on it or some type of infectious disease, it's got to go through your GI tract. Your first line of defense is your stomach acid. Your second line of defense is everything in your GI tract. So having the proper balances of bacteria to overcome things, that can help improve your overall outlook.
Okay.
I missed CoQ10. I got to do CoQ10.
Oh, yeah, good.
Many patients with a heart and cholesterol challenges are maybe taking a statin drug. Statin is a fancy word for drugs like atorvastatin or simvastatin. You may know them more as Lipitor or Zocor or even Crestor. Those medications work great to lower your cholesterol, to help you get to where you need to be based on the clinically relevant medical literature. But they can also deplete CoQ10. CoQ10 is a nutrient that is essential for the mitochondria in your heart that help produce the energy for your heart muscle to beat. So you want to make sure that you support that particular function. You want your heart muscle to have all the energy it needs to function. It can also help minimize the risk that you could have leg cramps or muscle weakness in your thighs and legs. So CoQ10 is also on my top 4 of essential vitamins and nutrients.
Okay, we hit the vitamin program, children's vitamin program, which has been very popular, and also our monthly blood screenings. There are some other things that we do as a pharmacy, and which are unique, I believe, unique to us. And we cover the screenings, we covered the vitamins. There's always a pharmacist available for consultation. And we have a fairly new feature, an app for your iPhone.
We do. So whether you're an Android user or an iPhone user, you can have the Medicine Center right in your pocket. And you can do that in a number of ways. If you go to our website, medshoprx.com, it's medshop.rx.com. There's a link there to the Apple or the Google Play stores, and you can download our app. You can manage your prescriptions right from your hand. You can even hook up, if you're the caregiver in the family, if you're the mom, because we know the moms are more responsible than us dads. You can link all your kids and even us, the spouse, on there, so you can take care of all their medications just from one profile. You can see when they need a refill. You can see when they need a new prescription from the doctor. You can even schedule reminders on your phone to remember to take your medication. So if you're a busy person and you forget that you need to take a certain pill at a certain time, you can set a reminder right there in our app to help remind you when to take it. And as a complement, you can also head over to your favorite podcast server, and you can download our Medicine Center, our Health Matters with Medicine Center Pharmacy on your podcast app. So on Apple, they have the podcast app. You can just go in there and open up that little purple icon and type in Health Matters with the Medicine Center Pharmacy, and you can subscribe right there. And in the Google Play Store, you can do the same thing. So you can have us with you all the time, whether you're driving to and from work or you're home late at night and forgot to refill your prescription. You can open up our app and do it right there.
And there are other ways they can listen to our program, correct?
Yes, you can listen to it from our website. You can listen to it from Facebook, like our Facebook Live, if you're watching on Facebook right now. And if you're on Facebook Live now, please don't be afraid to post up some questions. And in addition, you can get it from a number of different places, whether it be SoundCloud or any of the podcast platforms. So you can find us on LinkedIn, you can find us on Libsyn, you can find us on Wirefeed. There's wherever you find your podcast, you'll find us.
And I think you mentioned this, but you get a text alert when your prescription is ready.
Yeah, if you need reminders, or we'd like to give you helpful reminders, we can give you a phone call, an email, or a text when your prescriptions are ready for pickup. So it's something that's real convenient. I usually enjoy it when my wife reminds me, I've been getting a text for 2 days that I need my prescription picked up, and I'm working in the same pharmacy that it's been filled at, so sometimes I can get in trouble there. But, we all need a little bit extra help. So a simple text, that's probably been the most popular way that people have been asking us lately to notify them that their prescriptions are ready. And, we can do that. It's real easy. It's automated, and we can help keep you on the track.
Okay, guys, you're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshoprx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Hi, Paul White for the Medicine Center Pharmacy, a locally owned Health Mart pharmacy. Do you know that we partner with Mercy Medical Center to provide low-cost blood screenings in our pharmacies? You can choose from the following screenings: thyroid for $5, lipid profile for $8, total cholesterol for $2, glucose for $2, and A1C for $10. These are the same tests you would receive from your physician. Please give us a call at 330-454-8772 for dates and locations. Come see us at your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Health Mart, caring for you and about you.
Brighten your day with beautiful stained glass from Studio Arts and Glass. Let the sun shine in through a stunning beveled glass window that forms a rainbow on your walls. Commission a piece of art to cherish for years. All at Studio Arts and Glass on Apple Grove and 77 in North Canton. Open Monday through Saturday, 10 to 6, or shop online at studioartsandglass.com. That's studioartsandglass.com.
We keep hearing on the radio that the big chain pharmacies have all kinds of zero copays on Medicare Part D programs, as do we. But our pharmacists using iMedicare software have saved Part D patients lots of dollars by helping select the right Medicare Part D plan during open enrollment. Not all Part D programs cover the same drugs. Our pharmacists make sure that the Medicare Part D enrollees see all the available programs that are the best for them. The Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia, 13 pharmacists to serve you. See us on MedShopRx.com. Welcome back to Health Matters with the Medicine Center Pharmacy. You're listening to Brad White and Paul White today. Talk about pharmacy. And I have to do something which I forgot to do earlier. You don't want to miss the upcoming Kiko auction, Absolute Auction, April 12th with auctioneer Bill Gill Jr. You'll find art, antiques, collectibles, and furniture, all from the Aurelia Krugliak Revocable Trust. And this, I've looked at this sale. The merchandise is very, very interesting, including statuaries, Indian pottery, sterling, African masks, books, furniture on site, and online bidding is offered. Mark your calendar for Thursday, April 12th at 3 p.m. at 3201 Parkway Street Northwest in Canton. Call Bill Gill Jr. at 330-418-8727 or visit KikoAuctions.com for pictures, directions, and more information. Don't miss this auction. It is very unique.
All right, I wanted to mention on a positive note, we do, in our New Philadelphia Medicine Center Pharmacy, we are a PCAB accredited compounding pharmacy. And what all that jargon means is we have gone the extra step. We weren't required to, but we went out on our own to make sure that our quality processes, program, and compounding laboratory facility is accredited by PCAB. It's an organization that holds us to a higher standard. There are only, I think, there might be 5 or 6 pharmacies in the state of Ohio now that have that designation, even though there's hundreds and hundreds of pharmacies in the state. But one of the things that I'm really proud about lately is one of our pharmacists, Janice Marciniak, she recently was certified as a hormone replacement specialty therapist. One of the segments of our pharmacy practice that we do very frequently on a daily basis is hormone replacement therapy for both men and women. And it is something that we can work with your physician and help customize therapies for you that are designed to meet both your symptom profile and your lab work profile. So you can appreciate that everybody has a different body type, you know, tall and skinny or short and stout. But sometimes medication therapies need customized, and that's where our compounding pharmacy comes in. We service a variety of populations of patients. Everything from right now, we have roosters, we have rats, we have cats and dogs as patients. We've had snakes and birds in the past. To adult men and women. One of the things that is rewarding and humbling is to be able to help patients, often that are children. We can make a variety of medications with a prescription from a doctor for heart conditions, seizure conditions. And, sometimes we even make therapies that are required to help treat a condition that is something that a patient is dealing with that they just can't get a medication commercially made. So, for example, a compounding pharmacy, what we do is we take commercially available medications and put them in a dosage delivery form that a patient can use. So think about a child, maybe there's a tablet or a capsule that's made by a big drug manufacturer somewhere in the world. But that kid can't swallow a tablet or capsule. So we put the drug in a form where they can take it, whether it be a liquid, maybe it be a topical cream. So those are things that we can do. We can manipulate ways to deliver a medication to help the patient, to help the doctor deliver a therapy that this patient needs to get them well or keep them as comfortable as they can be.
Did you want to mention genetic testing, or do you want to pass on that?
We can mention genetic testing. One of the things that I am really excited about, we're on the brink of launching genetic testing in our pharmacies. What's genetic testing? Well, if you watch the Olympics or you watch TV during the Christmas season, I guarantee you saw ads from companies that had a little kit that you could buy to find out your ancestry and where you're from, and if you needed to wear a kilt or if you needed to wear lederhosen. Well, this is kind of an extension of that, okay? Your body, everybody's body is a little bit different with respect to what they can process as a medication. And if you've ever taken a medication and it's made you ill or given you an allergic reaction, that's a perfect example. So genetic testing is a tool that you can use to work with your doctor, especially if you have certain conditions like you need to take a blood thinner or you need to take a medication to prevent the recurrence of a heart attack or stroke. We need to help you make sure that that medication is the right one for you. And genetic testing can help you identify whether or not your body can metabolize these medications and if it's something that you can take or if maybe the doctor should choose another selection. Now, in the past, your doctor's done the same thing, but unfortunately it's been that trial and error thing. So if you're tired of trial and error and you want to know exactly what your body can metabolize, whether it be a medication for your heart or an antidepressant or even for a pain pill, the Medicine Center Pharmacy is going to be able to help you do that. So you can stop in the Medicine Center Pharmacy and you can ask the pharmacist. My name is Brad. You're welcome to give me a call at the pharmacy and we can talk about it. But, don't be afraid to explore that option. It may be something that could really help save you a lot of trials and tribulations down the road.
You know what? We have a famous pharmacist working for us, too. Melissa, who is the store manager of our Minerva store, is going to be running in the Boston Marathon on Friday, April 13th, which is amazing. She actually,
that's our send-off party for Melissa.
Oh, is it?
Friday, April 13th.
I'm reading the wrong notes here. But anyway, the Boston Marathon. Look it up. Tell me what the date is.
So you can come to the Medicine Center Pharmacy on Friday, April 13th from between 11 and 1, and we're going to have a little send-off party for Melissa. So we're going to get her all excited. So we're excited to have her run, and it's quite an accomplishment.
Melissa is a very dedicated runner. She runs every morning, very early before work. So, great gal. We're hoping she's going to win the Boston Marathon.
No pressure.
Okay.
No pressure.
There's no pressure here. Okay. Anyway, okay. We're real close on time. Just to mention quickly some of our services: low-cost healthcare screenings, free kids vitamins, pharmacist consulting, text alerts, free delivery, pill packets and blister cards for medications, affordable diabetes care, compounding, medication synchronization, and pet prescriptions, immunizations, and a loyalty program. So, where you get points. So we didn't talk about that, did we, today?
No, you don't. But, every purchase you make at the pharmacy, you can get a reward on. So ask us about that.
Okay. So, here we go. Thanks again for our sponsors, Studio Arts and Glass, Kempthorne Motors, Keiko Auctioneers, of course, our technical producer, J.D. DeAngelis. As always, thank you for listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you again next Friday right here on News Talk 1480 WHBC.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's medshop.rx.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy. The preceding program was sponsored by the Medicine Center Pharmacies.